We're going to talk about sulfonamides and trimethoprim, otherwise known as antibiotics. So that's a specific class. So we'll get started on that. I don't have very many slides for this. All right, so sulfonamides and trimethoprim. You're going to see these together, otherwise known as Bactrim. So it's sulfa and trimethoprim put together. But we'll talk about what the sulfonamide does and the trimethoprim, and then it works well together to enhance getting rid of the bacteria. It's a broad spectrum antibiotic. It works for a variety of things, and it does suppress bacterial growth. Now this works by inhibiting tetrahydrofolic acid. So it's a derivative of folic acid or folate. And this specific tetrahydrofolic acid, it suppresses bacterial growth by inhibiting that's part of the bacteria. All right, so it's the first drug available for systemic treatment of bacterial infections, so sepsis. But now there's more effective and less toxic drugs available. So I'm talking about sepsis, but it's still used for other things. And inhibits the synthesis of folic acid, which I had talked about. So mammalian cells do not manufacture their own folate. Not affected as bacteria are affected. I don't really know what that means, which I'll tell you the truth. But I do know that bacteria has a derivative of folic acid, and the way these drugs were put together is to inhibit that folic acid, tetrahydrofolic acid in the bacteria, and so that'll suppress bacterial growth. So I hope that makes sense. What these are primarily used for now is UTIs. It's also used for MRSA when put together with the trimethoprim. Chlamydia, it can be used for, although it's not first line for chlamydia, it can be used for chlamydia. Ulcerative colitis, it can be used for. All right, so some adverse effects. With any sulfonamide, there's other sulfas out there, such as hydrochlorothiazide for hypertension. There is sulfasalazine, which we've already talked about. There is burn ointment that can be used for that, and that's a sulfa derivative. You may see those used like in nursing homes or on burns. But some adverse reactions are Stevens-Johnson syndrome, some hematologic effects, connectitis, which is with your eyes, renal damage from crystalluria. So Stevens-Johnson syndrome, I know I touched on that in class a little bit, but it's a really severe hypersensitivity reaction that causes basically you are breaking out in big blisters from the inside out. It's just in burns. It's just awful. Drug interactions, you can have some hypersensitivity to just other drugs, so you just have to look up to make sure that they're not interacting. Microbial resistance, so there are some resistance, especially among gonococci, meningococci, so don't use it for meningitis, streptococci, shigella. So you're not going to use it if you have a shigella you see with diarrhea, and streptococci, which you could see with like strep pneumonia and that bacteria. It's not going to work for that. All right. All right, so the silver sulfadiazine, that is what I was talking about, and mefenide, which I've never used, but I've used Sulfadiazine before, and that's another sulfa. So what that does is suppresses the bacterial colonization in patients with second and third degree burns. Again, I don't see the mefenide used. It looks like it can cause some acidosis, and it can be painful when applied. So the Sulfadiazine ointment, it's usually pain-free, and it does get absorbed systemically. Just remember, anything on the skin can be absorbed systemically. Then we have the trimethoprim, and this works again with the folic acid. So when you have the both together, the sulfonamide and the trimethoprim, it just is an additive effects, so that we have Bactrim. So it's Bactrim double strength, it's called. And this is also can be used in UTIs, which you'll see E. coli, protease, Klebsiella. These are all bacteria that are in acute urinary tract infections. Again, this can have some hematologic effects, can cause some hyperkalemia, and you can use this. You should not use this in pregnancy and lactation. But now we mix the two together is what you're going to see. You will see this definitely in your career, and it's called Bactrim. You'll see it as to the trimethoprim, sulfamethozole, and TMP SMZ. You may have already had this prescribed to you before, and it's used commonly for UTIs. It's actually one of the first line. With Macrobid is number one. We can also do an alternative of the Bactrim. Otitis media, bronchitis, shigellosis, because when it's combined, it can work for that. Pneumonia caused by pneumocystis pneumonia, GI infections. Definitely there's some adverse effects, GI stuff, so you have them take it with food. All these antibiotics you're going to have them take with food. Unless it says take on an empty stomach, you take it with food. Remember the Stevens-Johnson syndrome. You really don't, if they're just taking a 7-day course and if they're healthy, you don't need to watch labs for hypotassium, but just know that it can cause hyperkalemia, and you can get a sulfa rash. And that's it on sulfas.